Hey, it's Dr. Brosh. Many people with back pain say the sentence, my back went out. If the pain goes away, then that's okay. But the problem begins when it stays and becomes chronic. One of the most surprising things I see in patients that I meet is that they don't really know how pain is created in the body. And without knowing how pain is created in the body, it's really, really hard to release it and heal from it. And by the way, this is also true for many professionals that work with people who suffer from pain. When you ask the question, how pain is created in your body, most people with chronic pain don't know the answer to that. Their descriptions would mostly be describing their sensations or feelings around the pain, like it hurts here, or it feels like squeezing or tension, but that is not the mechanism. Knowing about the mechanism can really help release from pain. So let's start fixing it today. What is pain? Pain is a primitive defense mechanism that we have in our brain and body. Think of it like an emotion. Emotions are located in the more primitive areas of our brain, and they function to help us survive and thrive in life. And pain is in many ways exactly like that. There are two types of pain. One is called acute pain. Acute pain is the pain that we feel, for instance, when we injure ourselves, or for instance, when we experience an illness like a flu where the muscles can ache. And that's good pain because it alerts us that something's going on in the body, and then we can get the right treatment for it. But pain also has another side, which is chronic pain. And chronic, by the way, doesn't mean forever. It just means that it is there for more than 3 months. So it's a matter of time, not of something that will last forever. Chronic pain works differently. It also tries to protect us, but it can go sideways because it can start protecting us from things that are not really dangerous. For instance, many people with back pain are afraid to sit on chairs. They develop this fear of sitting. They read everywhere that sitting harms your back and things like that. Research shows differently, by the way. When studies try to validate the link between more sitting and more back pain, or the reverse, less sitting and healing from pain, there was no relation, there was no connection between the two. Sitting is not as healthy, is not that great for you if you do it most of the day, so you should take breaks, but that's a general health recommendation. So sitting is one thing. Lifting, there are many people who say I should lift with my knees bent and not bending my back, which has no proof, no foundation in research. And the brain starts to protect us also from things that are really not dangerous, like when we experience some tension in our life, financial tensions, tension before an important meeting, when there's friction in a relationship, when we need to talk with our boss or with people who are close to us. The brain learns to protect us also in these instances. And then it's like a snowball that begins to expand to more and more areas in our life. If you're suffering from chronic pain, so for instance, chronic back pain or neck pain, and you don't understand that, you don't understand that tensions in your life, that frictions in your life, that uncertainty in your life can cause or exacerbate pain, then your next step would be to do some imaging tests like MRI or CT. This is what most people do, and it also makes sense to rule out more serious medical conditions like a fracture, like other inflammatory, whole body inflammatory diseases. That makes sense. But then most people who go through imaging tests are left without a proper diagnosis. And there's a very good reason for that, because 85% of the people with chronic back pain don't have a medical finding that can explain their pain. So now the plot takes another turn. Not only that you didn't understand your pain and where it's coming from, in most cases, then you do an MRI or a CT scan and you think, okay, those changes, maybe a bulging disc, maybe some degenerative changes, a very frightening term for many people, that are actually in most cases, changes of time, now they are considered as the cause of the pain. And what happens next is that you try to treat the organ in your body that is painful, for instance, your back, your low back, without success. And that's the story of so many people with chronic back pain. They try so many treatments, so many options, but nothing really helps. By the way, if this resonates with you, there's a starter kit with a lot of knowledge, meaningful resources that I've prepared for you. You can download it free below this video. And if you like this content, don't forget to like and subscribe to this channel. Why the treatments don't work? Exactly what we've just explained. If your pain is generated by the brain, which in most cases of chronic pain is the case, and you're trying to treat the organ in your body, your back or your neck, it will not be successful because you are treating the wrong thing. You are trying to treat the wrong mechanism, and this brings, in best case scenarios, it only brings a partial relief, but in most cases it will fail. And that's also the solution if you understand the mechanism and you understand that your pain, after ruling out other serious medical conditions, could be generated by your brain, then you start shifting your attention towards the true mechanism that causes it. This can open for you the path to healing. The first step after understanding that pain can come from the brain and not from the body tissues or organs where you feel it, this is real pain, it's important to say that. You feel it in your body, but it's just generated by your brain. The first step after understanding this option is doing what's called reframing. Reframing is treating your pain or reacting to your pain in a different way. Let me give you a sentence. For instance, you can use this sentence. My pain is real, but it's not coming from tissue damage, it's coming from my brain. And the brain is changeable. We know that neuroplasticity is our brain's ability to change. This means that also pain can change. Your very real pain can also change when it comes from your brain. So instead of looking at your body organs, you divert your attention towards what your brain is doing. You're starting to notice what thoughts revolve around pain, what emotions or feelings arise when you experience pain. How does pain influence your behavior? Do you avoid doing certain activities? Did you stop meeting friends? Did you narrow your connections because of the pain? You start looking at all of that and changing it one by one. When you divert your attention back to what your brain is doing, then you can really start healing. If this resonates with you and you want to learn more, watch this video here. It's a lecture that will explain to you how pain is created and what you can do more to release yourself from it.